Good morning, teacher and class. My name is Andrea Vivero. I will talk about enhancement of the efficacy, physical therapy, and physical modalities for the control of chronic musculoskeletal pain. Definition. Physiotherapy is a science-based profession and takes a whole person approach to health and well-being, which includes the patient's general lifestyle. The profession helps to encourage development and facilitate recovery, enabling people to stay in work while helping them remain independent for as long as possible.
Physiotherapy is the assessment and treatment of individuals that are suffering from injuries or long-term conditions or disabilities. Treatments include hands-on therapy, exercises, movement, and education. And it enables people to return to the activities in life that they value the most. Nuffield Health have the largest network of physiotherapists outside of the NHS. Our physiotherapists are all chartered and all registered with the Health and Care Professions Council. We have a range of experts in-house that can treat a variety of musculoskeletal injuries. The first session with a physiotherapist is really important in helping to structure and plan your recovery. It's an opportunity for you to ask questions about how long your recovery may take and what you can do to help that. The physiotherapist will need to examine the area that's affected and also determine if they're able to help.
Application in physical therapy. Physiotherapists help people affected by injury, illness, or disability through moving and exercise, manual therapy, education, and advice. The main time help for people of all ages, helping patients to manage pain and prevent disease. Pros and cons. Pros: pain relief, posture correction, increased coordination, improve balance to reduce risk of fall. Cons: there are disadvantages to the efficacy of physiotherapy. However, there are certain techniques which don't have sufficient evidence of efficacy, as more evidence more research is still needed. Issue apply in Ecuador. Chronic pain affects 3 out of 10 people in Latin America, according to the World Health Organization. Based on that calculation, in Ecuador, which has a little more than 17 million inhabitants, there will be approximately 100,000 people facing this condition. Pain is the most frequent reason for consultation in medical consultation. The prevalence of this problem has not been measured in Ecuador. However, some studies show that approximately 30% of the population of Spain suffer from chronic pain, on that 1 for every 5 visits in outpatient clinic is due to acute pain, such as main symptoms of a new disease. Conclusion. It is concluded that future efficacy trials should be designed to determine whether management strategies that reliably affect symptom score also make a difference in quality of life and whether improvements last longer than the therapy period. Also agreeing with the article by Malone and Struve that future research should be directed to determine study what are the common characteristics of various therapies that are useful for patients in light of the finding that efficacy appears to relate to the amount of therapy received. It is important to find out what the optimal dose of care is and how it can be delivered in that most cost-effective manner.
A physiotherapist will see you on a one-to-one basis and assess you to work out a treatment plan that works best for you individually. Often in chronic pain conditions, the pain can be non-specific. It can move around, so you don't always have pain in the same place, and it can be unpredictable what exactly sets it off. And very often the degree of pain you experience does not necessarily relate to how much structural damage there is in the tissues. Physical factors that could be contributing to your pain could be poor posture, deconditioning or weakness of certain muscles, stiffness or overactivity of other muscle groups, or maybe executing certain movements badly. Other factors that could be making your symptoms worse include poor sleeping patterns, emotional factors like stress, anxiety, depression, or grief, as well as possible hormonal factors like adrenal overload or exhaustion. As physiotherapists, we recognize that these physical, psychological, social, and environmental factors can impact on movement, function, and quality of life. We use our skills to identify what is limiting an individual's movement and performance, and to help individuals decide how to address their needs.